cognitive assessment of PBFTD, the first immediately area that we should talk about is social cognition. The most classical assessment of social cognition tasks are the kind of emotional recognition task, empathy task, or the so-called theory of mind task. Those are, the last one are tasks where you evaluate how the people infers the other feelings, behaviors, and intentions. So it's kind of reading the mind, right? So this task has been extensively validated and assessed across PBFTD populations in the world. And we have very useful tasks like the mini-SEA that assess emotional recognition and theory of mind, as well as many other small batteries to assess different aspects of social cognition. And there are multiple studies that have been shown that this kind of assessment are really, really powerful to complement the sensibility, specificity, and in general, the classification of PBFTD against other frontotemporal version and other neurodegenerative conditions. But at the same time, a huge problem is those are really, really simplified tasks. So the social cognition task needs really, really a more systematic validation. So there are so many different tasks assessing, from empathy, social cooperation, social decision-making, interoception, or emotional self-regulation. All these processes are developed with different tasks that are not harmonized, not systematized. Moreover, this kind of task assessing socio-emotional behaviors are really, really more cultural dependent. So for instance, social norms in Latin America are quite different in US. So in Latin America, it's very common to touch and estrange, for instance, a typical BBFTD behavior, I would say, that it won't be the case in US, right? So these kind of cultural adaptations need a lot of work to do it. But still, I think that there is another challenge that we're trying to understand like simple behaviors, like, like emotional recognition being something that can be disentangled from theory of mind, from social decision-making, and this is not true. Social cognition involves a set of interconnected behavior that change all the times according to the context. Implicit context clues can help to the people to understand the social meanings, and this is a challenge in the field. We need to develop more ecological tests that resemble the everyday cognition, the everyday interaction. So imagine that you are in a social interaction situation. You are not just having emotional recognition. You are combining emotional recognition with empathy, with language, with changing the tone for talking with other person, using social information, using social norms, and all these processes are happening simultaneously and in a very, synergetic way. This kind of assessment, in where I'm pretty sure that BBFTD patients fail more, are really difficult to move to the lab or to the neuropsychological assessment. So given this situation, I think that wearable devices, wearable recordings, more ecological settings, using virtual reality can help to transform the evaluation of the social cognition that is more lab or domesticated in more like the social cognition in the wild, as happening everyday behavior. I think that this is one of the most important change because it's a trade-off, right? We need to move toward more ecological assessment of social cognition, but at the same time, we need to be able to harmonize, to standardize and to develop multi-centric comparison between regions, countries, language. So I think that this trade-off is the big challenge for the future.